Hi, I am Erin Edwards. I'm going to be talking about the influenza and how that affects older populations. This is something we're all really familiar with. I'm sure many of us have experienced having the flu, and while that may have taken us out for a week or two, maybe we weren't feeling so great. Uh, this is something that, as young people, typically we don't pay it much mind, but we really need to be cognizant of the great risk that this can pose for our older loved ones. So, the definition of influenza is a highly contagious viral infection of the respiratory passages causing fever, severe aching, and it often occurs in epidemics. This is also an interesting topic to discuss during this unprecedented time of COVID-19. A lot of that conversation is really similar to the influenza conversation, and it has to do a lot with how older adults are at greater risk and very vulnerable. So the CDC states that in regards to the typical influenza, which can occur in different strains, and it's different every flu season pretty much, they state that 70% to 85% of seasonal flu related deaths occur in people 65 years and older. And this doesn't just happen simply because somebody reaches that age. They're not just going to die because they're 77 years old. But this happens because often older adults have other chronic health conditions, things like diabetes or hypertension, and the flu in combination with those other chronic conditions can be pretty devastating to someone's life. Interestingly and sadly, the flu is often missed in older adults. The typical symptoms for a flu for a younger person might be a fever of 100 degrees, a cough, a sore throat, body aches, things like that. For an older adult, they don't always present the same way. Their symptoms may not include a cough or a sore throat or even a fever. In elderly people, it's common to see dizziness, to see increased confusion, which is categorized as delirium. We see elderly people feeling a lot weaker and decreasing in strength, and also see a loss in appetite. Also, elderly people with pre-existing health conditions of the heart and lungs will see an intensification of their symptoms in those conditions. So you might see a loved one that has asthma having an increase in difficulty with that. So those are interesting ways that the flu presents in older people. And it seems to be very common that as people age for illnesses of the flu or other common illnesses, elderly people's symptoms don't present typically as they did maybe even when they were younger. It could be an older person and a younger person with the same strain of the flu, and the older person's symptoms will present very differently. So that's really important for us as loved ones and community members to be on high alert and know how symptoms of the flu will present in the older ones that we love. Because it's not uncommon for an elderly person to only exhibit signs of confusion and weakness as their flu symptoms. And knowing how risky the flu can be, that makes it very important for us to be on really, really high alert. And for healthcare providers as well. And so a lot of this information is very similar to what we're hearing in regards to the COVID-19 conversation. And the CDC also gives us the same very similar guidelines for the flu and for the coronavirus. So washing hands very frequently, staying away, maybe not being as socially active or active in the public as we typically might have been. In regards to the coronavirus conversation, the CDC states that 8 out of 10 deaths reported in the US have been in adults 65 years and older. So that's huge. It really shows us the risk that older people have to these illnesses. But we know for the typical flu, the influenza, flu vaccines are super important, and in recent years they are developing vaccines that have a higher potency, and they result in increased immunity to the flu. So this is really, really huge and important for our older populations, and it's exciting to see those developments, but it's scary, especially during this time, and I'm thankful that we have a greater awareness for the vulnerability of our older populations, and I think, again, it's so important for us to be on guard and have this information to combat a lot of the false facts that we see on social media and the news. Again, it's not simply because people are old that they become weak and unable to fight things off. As people age, they don't lose value, so it's important for us to see the risk that might be posed to our older populations and step up as younger people to protect the vulnerable. So I hope that you might have learned some things, and thank you for listening.